Hypertension is actually the leading cause of preventable death in the world.
Did you know that Canada has been leading the world in blood pressure control for over 20 years? Today, we speak with leading experts from Hypertension Canada to learn more about declining rates in control in women over 60 and the importance of blood pressure monitoring to lower risk.
Hypertension is a state in which your blood pressure is consistently elevated over time. So we know that there's a very tight link between hypertension and adverse health events. And hypertension is the leading risk factor for heart disease and stroke. And it's through these conditions that we see blood pressure do its harm to Canadians. And this is why we find it so important to address the issue of hypertension in Canadians.
Hypertension Canada is Canada's only voluntary charitable organization that is interested in the treatment and control of high blood pressure or hypertension. Hypertension Canada was the first in the world to produce authoritative guidelines for the treatment of high blood pressure, and those are used by members of the healthcare team to have the best evidence for treating high blood pressure.
Canada has always been a leader in hypertension care since the initiation of our guidelines program in the late 1990s. Unfortunately, over the last few years, we have seen some concerning trends.
Our research team at Hypertension Canada has just published a paper that has shown that high blood pressure treatment rates have actually gone down, and that's the first time in our history that we've seen that. So the group that is most at risk is women over the age of 60, and we find that to be unacceptable.
Diseases associated with hypertension, heart attacks, strokes, heart failure, for instance, are all conditions that we know are tightly associated with the presence of hypertension. And these conditions are also the leading cause of death for women over the age of 60 in Canada. So it really is concerning to us that this is something that we're losing ground on.
Hypertension is known to be a silent killer. Measuring your blood pressure regularly, as instructed by your doctor, is an important part of reducing risk.
So the reason you should take your blood pressure at home is because you can't actually tell if your blood pressure is high, because high blood pressure doesn't produce any symptoms. So the only way that you could know is to measure it properly on a valid device yourself at home. So this is an area where you're going to have to take charge of your own health.
And even prior to the pandemic, we knew that home blood pressure monitoring was a critical component of blood pressure surveillance for those who had had a diagnosis of hypertension. Do you expect that your blood pressure at home is going to be a little bit lower than we'd see in the office? So for most individuals at home, we would expect their blood pressure to be running consistently less than 135/85 millimeters of mercury. And for patients with diabetes or with heart disease, we would expect even lower numbers.
So there's two ways that you can know whether or not a blood pressure machine is accurate. The first way is you can go to our website and look for our list of validated blood pressure machines. The second way is all validated blood pressure machines will have a logo, the Hypertension Canada heart logo with a check mark on it that will tell you that it has been reviewed by us and certified to be accurate.
Your pharmacist can help you select the best monitor for your needs, and also how to accurately take your blood pressure measurements.
So blood pressure is a silent killer. Unless your blood pressure is extremely high, usually you don't feel it. There's lots of good blood pressure machine in the market. Usually I recommend my patient to go with the one that's been reviewed by Hypertension Canada. I like the one that measures the blood pressure from the arm because it gives more accurate readings.
So particularly during a pandemic, where it's difficult to get in to see a physician and maybe even a pharmacist as well, you're going to have to take charge of your own blood pressure. And so what Hypertension Canada recommends is that you buy a valid blood pressure machine and take those measurements at home. My hope for the future of hypertension in Canada is that we get better control of this important risk factor. So in particular, what we're looking at doing now is trying to find out why blood pressure control in older women has declined so much. Once we figure that out, then we will be taking steps to try to improve that.
To learn more about the importance of monitoring blood pressure to reduce the risk of hypertension, please speak with your physician or pharmacist and visit hypertensioncanada.ca.